Hey, FKASG9SSM. I am here to argue the healthcare debate on whether it is a human right or not. So, to start, I just made some points on my computer, so I'll probably be reading off that a little bit. So, I've heard from a few of you just keep repeating healthcare is a human right. Healthcare is it's repetitive. So, by telling me that healthcare is a basic human right, you're basically saying that by existing, someone deserves healthcare. Merely by existing. I'm sure you've heard this argument before, but hopefully I can put a new twist on it. So let's play a game. I'm person A and you're person B. I owe you healthcare because you're living on this planet and I have gathered a few more dollars than you. Tell me what I did to fall into that debt. When you owe someone something, you are in debt to them. That's how debt works. What did I do to fall into that debt? Certainly not try hard in school. If you say a person is entitled to healthcare because they exist, you're a person and I'm a person who claims to owe you healthcare. Tell me what I did to fall into that debt. You're telling me that a person is entitled to healthcare. I don't. It's just I don't understand why you're saying that. You're telling me that a person is entitled to health care because they live in America, they exist, or I guess you think anywhere in the world they exist. What about people who contribute nothing to society? Are they also entitled to health care? They don't pay into the system, the government don't pay taxes. Are they entitled to health care? Now, I exist also, obviously. I'm here living on this earth. Um, what am I entitled to? I exist, so I'm entitled to healthcare, right? No, I pay for my own healthcare. So, how do I owe it to you, person B, to pay for your healthcare? And don't I know right now you're thinking, "Oh, he doesn't care about sick people. He's, ignorant and evil and horrible." Well, I'm just getting philosophical here. Yes, it's sad that there's, starving people in the world and people who need medical attention. Um, and yes, I'm sad, and I wish it was me, and all that stuff. But donation to charity. Anyway, I'm not gonna get into that. You probably have a cow over that, and it'll take away from the point of my video. Anyway, you seem like a smart person. FKA. So I'm not sure what that stands for. So let's see if you can follow along with me. If you are a person, and I am a person, and you say that I owe you health care, that means I am in debt to you. What did I do to incur that debt to you? And I'd like for you to answer that for me. You can't let your noble causes, your, feelings of compassion, your feelings that are inside of you, get in the way of my liberty that was granted to me in the Constitution and by our founding fathers. I know it sounds like a stereotypical Republican remark. Um, but the point is, you can't let the needs of the recipients outweigh the rights of the providers. What the people who get the payment, you can't let their needs get in the way of the rights of the people who are providing the money. Um, there will always be rich people and poor people, and middle class people in the middle who say they're poor. But our country can't turn into a charity case. We need to be self sufficient. Numbers and statistics aside, let's not worry about that right now. Here's something I also would like for you to answer. What is the good in promoting the idea that things will be given to you, will always be given to you? The fact that, no, I don't need to take a second job because I know that my food will be entirely taken care of for the rest of my life if I stay under this line of income. How does that help anyone? How does this system of payment to people who haven't worked for that I'm not saying they don't work. I'm saying they don't work for the things that are given to them by the government. How does that help our country's self-sufficiency? How was that? How, anyway, next point. The people paying for the majority of healthcare will be the ones who could pay themselves. So, in a way, indirectly, by saying I have to pay taxes for this healthcare for other people, you're taking away the money that I would use for my healthcare. Um, it sounds stupid, but shouldn't there be a big national holiday? And I say national because you like big nationwide things. A national thanking day, not Thanksgiving, but where everyone who has benefited from food stamps, welfare, health care, and I'm not talking about Medicare here, they put money into that and earn that, and the same with veterans, hospitals, and stuff. A national holiday where everyone thanks people who have paid their taxes every day to contribute to the greater society. I know that's never going to happen, and I know it's stupid. I just think it's kind of interesting because the providers, the people, paying more taxes than than the money that they receive back from the government, which is practically none. Shouldn't the illegal immigrants, oh, let's not get on that topic, shouldn't they have a holiday or just a national day of thanks where they, prepare food and have a parade and thank the people who have provided them all this stuff? And actually, you don't need to comment on that. I just thought that was an interesting point. That's just a dumb thing. Um, so anyway, at this point, if your mere existence is creating debt for me, that you are entitled to health care because you exist, that also means that when you are hungry, I owe you food, and when you're thirsty, I owe you drink. Don't the recipients owe it to me to stay healthy? Because I'm footing the bill here. Does my person who I'm paying, God knows where, I don't know who the person I'm paying for is, does he need to stay healthy so I don't have to pay as much? Or are you encouraging that debt? Are you saying that that person needs to be more unhealthy so the rich person doesn't have to pay as much? Or, excuse me, has to pay more? You, person B, have the right to health care, and I have the responsibility. I owe you something because you exist. Now, what do you owe me? Do you owe it to me, the person I'm taking care of you, to not drink alcohol or smoke, things proven, especially smoking, things proven to be detrimental to your health? Or is that your right to do that? Because my responsibility is paying for you. That and all my hardworking friends have to pay for your $50,000 heart attack. I know you don't ask for a heart attack, but do you owe it to me not to be fat and reduce your burden on the system that I paid for? Do you? Oh no, no, you owe me nothing because you have rights and I have responsibility. And what's the thanks I get? They ask me for more. We need your help for more people this year because you are in debt to them. It doesn't make sense. So that's what I got. Those were all my points. I normally when I make these video responses, it cuts off the last bit. So I'm afraid that if I stop it now, then like half of what I said will be cut off. So I'm just gonna let it run for a second. It's good debate, by the way. Um, on your healthcare video page, I enjoy that. There's this guy, you probably know him, Republican Inbreeding. He's a tough cookie. It's hard to argue on his page. He just criticizes you, but I feel like on your page I get more of a constructive argument. So, oh, and who was it who told me I had a bowl cut?